next speaker is someone who does not require any introduction when it comes to autoimmune disorders. She is a rising functional medicine doctor, and she has a lot of experience in functional medicine when it comes to autoimmunity. Dr. Kalpana Shekhawat, Kalpana Gupta Shekhawat is the director at Freedom Age, Chairperson, Functional and Metabolic Medicine Academy. She's an MD Clinical Nutrition from USA, Texas. She has taken Bio Hormone Replacement Therapy training from American Academy of Anti-Aging Medicine, A4M, and introduced Peptide Therapy after further training from Peptide Therapy Foundation USA. She started her practice as a functional medicine practitioner 14 years ago and has been blissfully satisfied with the outcome since then. Her idea behind this approach is undoubtedly to address the root cause of problems suffered by masses that have no clue on prevention. She has an extensive experience on managing thousands of patients in short span of time, treating and reversing metabolic disorders such as autism, neurological disorders, cardiovascular conditions, endocrinological disorders, autoimmunity, and so on. Let us understand what she has to say on innovative approaches to autoimmune diseases. Over to you, ma'am.
Thank you so much, Dr. Karishma, for this wonderful introduction. I'd just like to add one more thing here, which is that we also have an academy, which is Functional and Metabolic Medicine Academy, where we are into training doctors, nutritionists, and health coaches into functional medicine. So that's doing very well, and we have a lot of inquiries. So if anybody is interested, then they can train themselves. Even the known doctors can also have functional medicine knowledge by taking a nutritionist course. So that's one. Another is I wish to thank the organizers basically for bringing everyone together on this platform, because I feel this was much needed in India, and I wish you all the success in this, because this should go a long way.
Thank you so much.
All the sessions, can you hear me?
Yes, I can hear you. Yeah. I can hear you, yes, completely.
So all the sessions have been truly enriching and insightful, and I'll be talking to you all about autoimmunity and ways to correct and reverse it. And the protocols that I'm going to discuss, basically, which I'm going to share with you, have been a result of intense research, and have first been implemented on myself, because I myself suffered from a lot of autoimmune disorders, which led to histamine intolerance and a lot of rash and everything. And every time I'll see that I'm a little stressed out, I would develop a rash. So I was looking for a solution, and of course not looking to be into medications, the immunosuppressive drugs and anti-inflammatories, which will only make things worse for my gut. So let's begin, and I'm just going to start sharing my screen. All right, so we are talking about autoimmune disorders, innovative approaches. So, we have evolved over a period of time. Of course, I started treating patients with autoimmune disease for many, many years now. Since the time I saw that there was a surge of patients, and we were really not able to identify the root cause as to why they are developing so many symptoms, and they don't have an understanding of where it is leading them and why are they having it. So yes, we started at the basic dietary protocols, but then over a period of time, now we have evolved, and we have reached to treating our patients with the help of peptides and all. So let me start off with my slideshow. Can you just put the first slide on, Karishma? Yeah, is this the first one?
This is the first one.
Yeah, the second one. Yeah. So this is turning out to be a leading cause of various chronic inflammatory conditions. And there is a steep rise in incidence of autoimmune diseases over a decade, and cannot be explained on the basis of genetic changes. Clearly, now it has been understood. There are definitely environmental factors. Can you go back to the, yeah. There are definitely environmental factors which are involved here and which are deeply impacting our immune system. Next slide, please. So the contributing, no. Can you go back? All right. Yeah. The next slide.
Yeah, this is the next slide, ma'am.
Okay. So the contributing factors may be the environmental pollution. So like we said, it's been identified that 30% is genetic and 70% is environmental, or maybe more. But that's what the data says. And the conventional medicine is mostly identifying only the 30% of the cases, and they're diagnosing autoimmunity in those 30%. But they do not identify the other causes which basically are leading to autoimmune reactions and the patients are suffering. So environmental pollution is one, GMO grain is another, dairy products, they come with hormones, pesticides in our food, heavy metals in our food, water and air, compromised gut immune system, which is leading to chronic latent infections and gut dysbiosis. So these are the major causes which I have been able to identify over years that our patients basically suffer from. Next slide, please. 60 to 70% of prevalence rate of preclinical autoimmunity in normal adult population residing in a metropolitan city of India is observed. And which is, since it's preclinical, obviously it goes undiagnosed. And obviously they keep going pillar to post and they keep trying to find out the reasons why they are having the symptoms which they are having. Conditions which may have underlying autoimmunity as their root cause. So practically all chronic diseases, which are basically because of the underlying inflammatory conditions, are caused by underlying autoimmunity. I have found in almost all the patients who have chronic inflammation, they have gut disorders and they have some or the other form of autoimmunity. So cardiovascular diseases, gut disorders like IBS, IBD, thyroid disorders, joint and muscle disorders, neurological disorders like poor cognition. Most of my patients, they come and complain of brain fog, difficulty to concentrate, anxiety issues, depression, and memory issues, Parkinson's, dementia, Alzheimer's, skin disorders like psoriasis and eczema. Like I myself suffered from it was not exactly psoriasis, but it was a rash. Every time that I would eat something sweet or if I'll be stressed out, I'll break into a rash. Or if I would eat something which I was allergic to. And even cancers, they have a close association with autoimmunity. Next. So there are some research papers which I've just tried to organize in here, and these are very clearly indicating that, so this particular research from NIH, it says 30% of autoimmune cases are due to genetic predisposition and 70% are environmental factors. So obviously we have a huge control on how we feel and how this chronic inflammation can be controlled, because 70% of this can be controlled by us. Next slide. So this is the basic flow chart of the mechanism. So there's an environmental trigger, which we just discussed now, and there's a breakdown in oral tolerance, which means the lining gets broken down. There are changes in the gut microbiota, enhanced gut permeability to large macromolecules, which are not supposed to be there in your bloodstream, immune reactivity, and then autoimmunity and neuroautoimmunity sets in. Next. So this is a picture presentation, and I think most of our my colleagues have already shared a lot of this information, but since I already have it, so I'll still go through it. So normal gut lining is here, and this leads to a broken gut lining as we have heavy metals, chronic latent infections, chronic stress, and of course a lot of dietary factors and multiple other, which I'm going to discuss further. This leads to the kind of breaks that you can see here. There's a compromised intestinal barrier, and this leads to undesirable antigens, food particles, and harmful microbes to start seeping into your bloodstream. And then there is a formation of antibodies against those antigens. And this, you can see the multiple organs that can be involved because of this. And these antibodies can have a molecular mimicry, and they can start attacking most of these organs, So it can manifest in any form. So therefore, autoimmunity has a wide surface. And the bottom line is basically the kind of lifestyle that you have, which needs to be corrected. So we briefly talk about conventional medicine outlook to autoimmunity. So so it used to be a rare disease, and it almost continues to be a rare disease as far as conventional medicine is concerned, because they have identification protocols, they have specific tests, which are like anti-nuclear antibody and a host of tests that they do. I see it with many of my patients. They bring a big bunch of tests, which actually doesn't make sense to me, because it's not even required. We kind of know it that there is an autoimmune reaction which has set in, and we don't need to put a patient on steroids or give antibiotics necessarily, maybe sometimes, but not always. And we don't really need to give them immune suppressive drugs. Rather, we will have to optimize their immune system to help fight the infections, latent infections, which they may be there, but they are treating. If they have to do an aggressive therapy, then they treat with immunosuppressives or immune modulating drugs, or if they have to go conservative way, then they will go with a symptomatic therapy, which is basically the anti-inflammatory therapy, which is mostly offered. And if it's too bad, then they'll give steroids, and they even tell patients that you will have to be on steroids for the rest of your life, off and on, the moment you have flare-ups. Now, they will never tell the patient that why you are having flare-up and how you should avoid them. And obviously, my patients, they keep going on, off and on, steroids. And I'm happy to say that a lot of them are off steroids now. Next. So now we talk about functional medicine outlook to autoimmunity. So we do intense investigations, like we all have already talked about it. There is detailed health history, which is very critical, because sometimes even just by talking to the patients and understanding what they're going through and the way they feel about themselves, the kind of energy levels they have, the kind of sleep pattern they have, the kind of diet they follow, you are able to kind of diagnose that, yes, they definitely have something going on with their gut, and we need to identify it. Identify the root cause and then start treating them. I do stool comprehensive testing. Dr. Anjali has already discussed a lot about the testing, and we are doing all these tests in our setup. And it's very enlightening to really do these tests. And I'm glad that now they're available in India also. And we'll also start looking at getting those tests done from India by understanding, how they are matching up. Because yes, we are getting a lot of information when we are doing it from DNA Life or from US, from Cyrex Laboratory and all. Food and multiple food intolerances. It's very critical that initially, in the initial phase, we basically help our patients get off those foods which are causing a chronic inflammation in their body. And yes, it is reversible. Most of my patients, they ask that, do we need to live our entire life like this? But no, that's not true. If they really are good to themselves and they really avoid the food which are causing inflammation, then it is definitely possible for them to come back to their normal diet. Of course, the healthier one, and not the processed food diet and stuff like that. But yes, it's definitely possible to come back to a routine life, and I'm a live example of that. I'm really able to, by God's grace, able to tolerate a lot of food which I was unable to. Can you go back, Karishma, the previous? Yeah, and then heavy metal and mineral testing is what we do. And genetic testing, I mentioned, because in some patients it becomes necessary when it's too critical, but otherwise mostly I avoid that, because cost is again a criteria, and I'd like to stick to the tests which are basically going to be most enlightening to me. Next. We do blood tests for Lyme disease. I have found 30% of my patients positive for Lyme, which basically is mostly underrated here in India. People think that Lyme disease is mostly in countries like US and UK. But no, that's not true. We are finding a lot of patients, and unfortunately, people who suffer from Lyme disease, and if we don't test them for it, they continue to suffer for years together. I've seen a patient of mine. She came to me with extreme depression, extreme neurological issues, and she went from pillar to post, and she had a big file of all medical records and everything, and she was not getting any solution, and she was on heavy antidepressants. And the reason which I identified was that she was positive for Lyme, both IgG and IgM. Of course, advanced Lyme testing is not happening in India, but looking at the symptoms and looking at this positivity, I would, though there are false positives also, but I'd still go and start treating, because I usually don't use antibiotics, and there is going to be absolutely no harm in eradicating the underlying infections. If it is not Lyme, if it is another bacteria, I'm sure that gets also treated with that. Candida is another which I commonly see in my practice and with my patients, and this is an imbalance. We don't obviously completely eradicate it, but this imbalance is huge and it causes a lot of issues, and they don't realize it, that it could be because of, it is basically, Candida is primarily because of three very important reasons. One is if they've taken oral contraceptive pills or any kind of hormone treatment in their previous times, or if they are highly stressed out, or if they're eating too many grains and sugar. So I basically work with them on if some of my patients who have PCOS and they've been on oral contraceptive pills to just regularize their cycle, which is such a disaster in my opinion. So I get them off, and then when I correct their lifestyle, they lose weight. So some of my patients have lost, young girls about 18 to 20-year-old, after losing about 30 kgs of weight, they become completely all right. There is nothing left which basically bothers them after that. Their periods are regular without any hormone pills. Then we have EBV antigen, which we have already discussed, that EBV and cytomegalovirus is also responsible. And then we also always test for H. pylori. Comprehensive testing to detect dysbiotic bacteria is also a part of our protocol. Next. Then we test for heavy metals. So we do a lot of testing with urine for heavy metal, hair metal analysis, and oligoscan. And basically, I do two because oligoscan is mostly demonstrating the intracellular level of heavy metals. So I'd also like to know what it is extracellularly, and I'll be able to correlate that. Most of the times, my patients, they come back that these reports are not basically in alignment, because we see some of the heavy metals intracellularly, but we don't see them extracellularly. So obviously you have to explain to your patients and let them know that these two have been done for the reason that we need to know if there are intracellular heavy metals as well. And they take time to come out. So it takes about a few years that we'll be able to get our patients off these. Then we need to, heavy metals, they attack on endothelial gut lining. So they have a direct impact. Apart from having great impact on your brain health, mental health, there is a great impact on your gastrointestinal health. They impede with normal functioning of GI mucosa. Next. So this is another research. So it's only about mercury, but then I would say that there are all the other heavy metals that we talk about, the cadmium, the arsenic. Dr. Lenny talked about at length about the heavy metals which can be impacting gut as well as the mental health and the entire body. So mercury is one. Its exposure is linked with huge chronic inflammation, autoantibody production, systemic autoimmunity. So this is what this research says. You can always look this up. Next. Then the next underlying cause could be chronic latent infections, which are not easily detected. Fungal infections like Candida, there are multiple species of Candida. When we do a comprehensive stool analysis, they are able to basically give us a whole list of different kind of infections. And the best part of those tests is that they also tell us the antifungal or antibiotics which are going to be effective against these, as well as the natural antiparasitics, antibacterials, antifungals, which will be effective against these, on which I put my patients over a period for about a year or two to have a complete eradication. Viral infections like EBV and CMV, then tick-borne, I already discussed, Lyme disease, bacterial infections, like Dr. Anjali mentioned, I'm in so agreement with her, the Klebsiella pneumonia, which is a very critical infection. And if that continues to reside in your gut, it will constantly secrete lipopolysaccharides, which will come out into your bloodstream and which will cause a constant autoimmune reaction, ankylosing spondylitis, backache. I had a patient who had a constant backache, and he went to all the possible places, and then eventually he was advised surgery. And then we did his comprehensive stool analysis and found out multiple, like Citrobacter, Klebsiella, then Pseudomonas, and multiple bacterial infections. And as we started removing those and eradicating those, we saw a great result in this patient. So it's very important to identify these. Then make the gut lining porous. So these infections, they make the gut lining porous. And examples of these infections, I've already discussed. Please move to the next slide. This is another research on Lyme bacteria, that how it is basically implicated in inflammation of joints, inflammation of gut. It suppresses your immune system. So obviously it has multiple reasons that it can cause constant chronic inflammation. And the biggest one which I have seen is the mental health disorders, which develop because of this bacteria residing for a longer period of time. Next. This is another research where H. pylori has been associated with Graves' disease and Hashimoto's disease, and eradication of H. pylori has, in real sense, I had one patient, she had H. pylori positive, and her TPO was 4,000 plus, and her, I think, anti-TG antibody was also somewhere around 2,000. And when we eradicated this infection, within 3 months, her antibody levels dropped to about some 200 and 300s. So this was very enlightening. Next. So we are continuing with the most common underlying causes. So food you may be sensitive to. So initially, I always like to get my patients off the food which basically is not working with them. So I always say that it is not permanent that you have to get off them. But currently, since your gut lining is damaged and you have developed sensitivity to these foods, it will be reversible the moment we are able to heal your gut lining, and you'll be able to take these foods, because these are mostly healthy foods. But for a certain period of time, for sure, they have to remove these. So gluten specifically can be a major problem, as this protein increases the permeability of gut. Undesirable substances, they enter into the bloodstream, and they act as a trigger, and they generate an autoimmune reaction. Next. Chronic stress, very important underlying cause of autoimmunity. This has, there are studies which are proving that chronic stress is actually leading to the gut, the intestinal lining, and the gut-brain barrier also gets badly impacted. Can you go back? So immune systems, they get suppressed with chronic constant stress, widespread inflammation throughout the body, and symptoms, they flare up if encounter any stressful event. This is another research, stress as a trigger of autoimmune disease. And this is talking about constant stress alters and amplifies the cytokines, which are basically the inflammatory markers. It also triggers neuroendocrine hormones. It leads to immune dysregulation and further leads to autoimmunity. Next. Over hygiene. So we've commonly seen that I've seen many parents, they're asking their children to wash their hands at least 20 to 30 times, and people have been using alcohol-based sanitizers so frequently, which are doing more harm than good. Like in olden times, that it was always practiced that before you're putting anything in your mouth, you must wash your hands. Goes well, but overdoing it is really not helping. Even using too many disinfectants is really not helping, because our system is not getting primed with the commonly occurring infections. And if it is not primed, then it does not have the capacity to fight, and that's why they set in. So this is how immunity in the body is developed if we are exposed. So the current research says clearly that we should not overdo on hygiene. Next. Circadian rhythm. I've seen many of the shift workers, they develop autoimmunity very, very quickly because they have a very poor lifestyle. They do not have their biological clock set right. They are eating food at wrong time. They're sleeping at wrong time. And we all know that if you are sleep deprived, your hormone tanks are not full because we have accumulation of all hormones for us to go ahead with the next day only at night. Autophagy does not happen because they are constantly eating until midnight, 2:30 or 3 a.m. in the morning, and then they're sleeping until late, and then their circadian rhythm is completely disrupted. So this also has a great contribution to developing autoimmunity. Next. So this is another research which says shift work is a significant circadian disruptor and associated with autoimmune hypothyroidism and rheumatoid arthritis, as per this research. So the next is, this is another research, the microbes that seed the intestine during Caesarean delivery. Can you go back to the previous slide? I think we skipped one.
Yes, sure.
Yeah. So Caesarean birth basically is another important deterrent, because obviously children, they are not getting the which children with normal delivery they get from the mother's vagina, and in Caesarean birth we need to take extra care if the child has been a premature delivery or a Caesarean birth, that we need to ensure that their gut flora develops well. Next. So this is the research on the same. The microbes that seed the intestine during Caesarean delivery or vaginal delivery may lead to changes in long-term colonization and subsequent altering of immune development. Yeah. Next. So like we already discussed that in functional medicine, we all practice this 5-hour protocol. Everyone follows it in their own way. They've all customized. I have also customized my own protocols, which are working best for my patients. So the basic principles remain the same: that remove, replace, re-inoculate, repair, and rebalance. So let's go to the next slide, and I'm going to describe as to how we do it. All potential triggers for inflammation, as already discussed, which are basically latent infections and heavy metals, the foods that patients are intolerant to, sugar and sugary products, all processed food, toxic metal load, stress, latent infections such as fungal, parasitic, bacterial. So we deal with all of these and we have developed something called biofilm bursting enemas, which I'm going to discuss at length, because most of the times I've seen it's really not very easy for us to eradicate the latent infections which patients have. If we think that, okay, we've done a 3 months protocol and we've given them a short course of antibiotics, and now we've put them on the natural antifungals and antibiotics and antiparasitics, but they have a tendency to come back because there are biofilms which basically will flare up the moment the conditions are optimum. So it's very important and critical. So even if they cannot afford to continue to take the treatment because of the time schedules and the finances, then we suggest that they should definitely continue to work upon their biofilms for over a year or two to make sure that there is a complete eradication of these latent infections. Next. Then we do replacement. So only when we have cleaned up the gut, after that we can start rehabilitating it. So add probiotics to restore flora, add polyphenols to your diet, which are berries, green, dark leafy vegetables. There's a lot which has been discussed, all the anti-inflammatory diet we advise to our patients, and which promotes the growth of healthy gut microflora. And we also really encourage our patients to have a lot of fermented foods if they work well with them, if they don't have histamine intolerance. It works beautifully to rehabilitate the gut flora. And it can be naturally made at home. One can ferment garlic, can ferment beetroot, can ferment cabbage, and so on. Anti-inflammatory nutrients, which are the nutraceuticals that we give, and we replace enzymes which are missing, and sometimes hydrochloric acid, and sometimes we encourage them to have foods which can increase the level of hydrochloric acid, which is apple cider vinegar, some lime drinks and stuff like that. Next. Then we come to re-inoculate. So regrow and build the gut flora, and alkaline water is something which I'll speak about. So I have recently started understanding that it's very critical to have initially in few years when people have autoimmune disorder. So there's a lot of acidic environment in the body. And there is, so the water which we drink, which I identified, which was eye-opening to me, that most of the people are using RO water. There is a positive oxidation reduction potential in that water. There is pH, which is acidic, and there are no minerals. So it's a big deterrent. So we need to switch to basically an alkaline water, which has a pH which is alkaline. Should not be extremely alkaline, but between 8.5 to 9 for a short period of time. And along with that, the water has to have the capacity basically to remove free radicals. So this particular water, this has a great potential to remove free radicals because the oxidation reduction potential is negative, as opposed to the RO water, which has a positive oxidation reduction potential. And similarly, it has more minerals, like the TDS is about 170 to 200, which is very critical for us to have replenishments on regular basis, which is why I'm seeing many of my patients, they are extremely low in minerals. So only gut is not necessary because they're not even getting it, and they don't supplement themselves, and the water itself is depriving them. Trace minerals, which we basically administer, then gut healing diet, essential fatty acids are given, and anti-inflammatory cooking pads, coconut oil, ghee, they work best. Avocado oil also works, but then again, it's very expensive and difficult to get. So I would say coconut oil and ghee are the best. Next.
Yeah. Sorry to interrupt you, ma'am. 5 minutes to go.
Okay. Then we go to repair. So we do probiotic enemas, IV nutrient therapies. So we replenish the nutrients with the help of IV therapies. Maintain sleep cycle. Bone broth is a very important part of my treatment. Collagen, which we give IV also, and it works beautifully. L-glutamine powder, all of us all are doing this. Anti-inflammatory diet, nutraceuticals to heal and repair gut lining, and peptides. I'll just speak few words about peptides. This is new, which I have introduced into my practice, and it's really working beautifully. So how it is helping is basically, it is reducing the span of healing. So if I would say that my patient is going to heal in about 9 months to a year, completely, then I would say that with peptides, I'd be able to probably shorten it to 3 to 6 months. Let's go to the next slide and I'll tell you how it works. So two peptides which I'm using for my patients is one is BPC 157. This is a natural peptide. It's an amino acid. It's a short amino acid chain, and it is naturally secreted from our gastric lining. And as we age, the secretion gets depleted. So we are just replenishing it, and it is a pretty natural way of doing it without the side effects. So clinical testing of this peptide has shown to accelerate the healing of gastrointestinal tract and combat GERD, IBS, leaky gut, ulcers, and Crohn's disease. It offers gastric protection. It is an ulcer peptidergic agent. It's cytoprotective. It helps improve GI mucosal integrity, and it decreases the gastric side effects of NSAIDs and alcohol. So these are the things, but I am mostly using it for gut healing for my patients right now. Next. The other peptide which I am using is Thymosine alpha 1, and this basically it works by increasing the secretion of T and B cell population from your thymus gland, and that's obviously because when your gut is heavily compromised, we've seen IgA levels to be at 4 or 5 or something. So obviously because they are constantly fighting the infections which are there, and they have got exhausted, and there are at times which are like exacerbated level of IgA. So balancing out your immune system is the key in this case. So when we give this again shortens the time that the patient is healing. It enhances the antibody responses, improves immune modulation between innate and adaptive cell response. It works against the inflammatory state of senescent cells. It's a potent anti-inflammatory for wounds, muscles, and joints. Chronic stress, depression, metabolic syndrome. So these all get addressed with this. Food allergies and sensitivities. So my patients are happier because they'll be able to start eating their favorite foods again sooner than later. And it provides protection against oxidative damage. Next. So finally, rebalance, healthy lifestyle, meditation, breathing exercises, circadian rhythm. Whenever we are, one important thing, whenever we are stressed out, we always do shallow breathing. So do remember to do deep breathing is very critical. I always advise my patients. Next. Thank you. So I don't know if I have any time to take questions, Karishma, or otherwise I'm happy to respond on the chat if there are any questions.
So one question is like a general question that's there. What is your say on bursting enema?
Okay, so bursting enema is basically, so the colonic lining has those biofilms which are formed of the latent infections which are there for a very long period of time. So we have created a concoction of at least about 10 herbs, including organic coffee in it. And these herbs together, they have like Podi, Arco, I can just name few, which basically remove Candida spores. And then there are multiple others which are there, which I can tell anybody who's interested one-to-one the details of this. So these basically are given, we are giving twice a week or once a week, depending on how bad the patient has symptoms. And if we do it for about 10 to 20 weeks long, it works beautifully. And again, we are shortening the time of healing for these patients.
There are many inquiries on your nutritional course. So I guess we'll be putting that on the WhatsApp group because everybody is interested in taking that.
Thank you.
Yes. Pandita is asking that what all constitutes the chronic stress. So it is just the psychological or the biological, physical. Could you please share some words on the same?
No, chronic stress is not just mental. chronic stress can be the stress of diseases which are there in our body, which are constantly there, and we don't realize it. But since there's a constant stress or it's constantly taxing your system, taxing your immune system inside. And that is also chronic stress, and that also leads to chronic inflammatory diseases. So many of my patients say that, no, I'm very happy, I'm a very happy person, and I don't have any stress, and I live my life happily. I go for golfing in the morning, and then I come back in the evening. But then we need to identify, are there any latent issues, maybe heavy metals or the other toxins, latent infections that we talked about, the lipopolysaccharides which get secreted constantly, and if they are in your bloodstream, they are causing you stress.
Thank you so much, ma'am. One last question. We would like to have one consider. Okay, so people are asking on Crohn's disease as well. As a general question to the, because it's a patient-centric conference, is autoimmunity reversible, or is remission possible in the same?
It depends. Again, I can only tell after I have investigated and explored the patient completely. There definitely have been reversals. I mean, I remember there was one patient who had come to us, and he had only 3 months, and he was posted overseas. He was in Japan, and he said that, ma'am, I can just give you 3 months, and whatever you can do in these 3 months will be the only thing which I can devote to this. And unbelievably, in those 3 months, there was a complete reversal that this boy got. He was only 25-year-old boy, and he had recently got a new job, and he didn't want to obviously compromise on his career because of this. So yes, there are possibilities, but again, it can't be said that as a universal rule it can be reversed or it can't be reversed.
Okay, thank you so much, ma'am, for your inputs on the autoimmunity. And we know that it's a rising kind of a chronic condition, which is actually leading to other conditions inside the body. Thank you so much for the insightful session. Thank you.
Thank you, Karishma, and thank you to everybody who organized this. Thank you.